Time. I know everybody is waiting for our VIP today, Dr. Ang. Lastly, I just hope everyone will gain new knowledge and information today with the help of our Dr. Ang and Nazira. So thank you so much for being here. Thank you.
All right. Thank you, YB Jamalia and Hayashi, for the introduction earlier. Again, thanks to everyone who's tuning in, and special thanks to our speaker, Dr. Ang Kim Teng, for spending her time with us talking about mental health on a Saturday morning. Now, before we properly start the session, again, I think it's important for everyone to just mute themselves so that we don't have any disruption during the session. But you are welcome to leave your camera on, because at least doctor will know that you're speaking, that she's speaking to people, not just screen or herself. I also want to raise the fact that doctor wants this session to be interactive. So there will be times where she will be asking questions, and in that instance, can I just ask those who are participating to use the reaction or hand raise function, so that we know that you want to participate and you want to answer, then we will mute. But then please mute yourself afterwards to avoid any echoes and noises. Again, you can post any questions you have in the chat box, but please don't spam lah, because then it'll be very difficult for us to monitor the questions. Now, coming back to our topic today, and as YB said, and I just want to reiterate it because it's very important, as we all should know, mental health is something that we need to be able to discuss openly in the community and in our society. In fact, it should be treated as important as physical health, because it affects the way we think, the way we feel, the way we act, the way we behave. And again, it's important more than ever now during this pandemic, where everyone is isolated. Some people have been separated from their families for weeks or months. There's that fear and anxiety, and all this uncertainty can be very overwhelming and stressful. Now, I'm not the expert in this area, so I'm not going to waste any more time. I'm now going to pass the floor to Dr. Ang. Dr. Ang, if you're there, you can unmute yourself, and the floor is yours.
Thank you, Nazira, and a very good morning to YB Jamalia, and thank you for your presence. And good morning to everybody that is in this meeting. I see a number of my friends here. Thank you for coming to support. Yeah, this topic on the first aid in mental health actually is rather new in the country, first aid in mental health. And I hope you'll learn something from the session. Now, I think all of us are very, conscious of our physical health, no? We spend a lot of money to keep ourselves very healthy. We are very conscious about nutrition, keep ourselves fit, go for exercise, and do all sorts of things. But when it comes to mental health, I don't know whether you understand what is mental health actually. Physical health is very easy to relate, but when it comes to mental health, it's not so obvious, no? And for many people, they think that, I'm okay, I don't need to know, okay? It's not relevant to me. So this morning, I'm going to share you how important it is and how relevant it is to every one of us. So now, what I'm going to do this morning, wait, Can you see the screen now? Okay, yeah. So, what I intend to cover, these are some of the areas. Now, before we can go into the first aid, you have to understand what is mental health problem and what is mental illness. Now, because mental health problem and mental illness, sometimes people get mixed up between the two. There is a difference between the two. And what's the difference? I'll explain later. Now, after we understand the concept of mental health problem and mental illness, then we go into mental health first aid. aid. And then, then we will learn why mental health first aid training is very important. And then we'll look at, where and how to seek help for mental health problems. And the most important part of it is how to become a mental health first aider. Actually, they are among us in this group. They are already, certified mental health first aiders. Congratulations to them. They were the first group. I'll share about them later in the talk. Okay, now this one requires a bit of interaction. Okay, you have to indicate, as Nazira has explained. You have to, show your hand or indicate somehow that you want to talk. Now I show you this this painting, three faces. Now I want to look at you look at the three faces and tell us, what do you see from this painting? Anybody? Any offer?
Yeah, can answer and then unmute lor. Unmute then answer lah.
I see sad faces and miserable.
Wow, misery, sadness. What else?
Depression.
Depressed. What else?
Confused.
Confused, huh? Oh, yeah,
Yeah.
maybe. Yes, yeah. What else?
Sleepy.
Emotions.
Suffering in silence.
Oh, suffering, yeah, suffering, yeah. What else?
Emotions.
Different colors also.
Different colors, huh? Okay, you got gray, you got
Fearful.
yeah,
Fearful.
fearful, huh? Yeah. What else?
Unhappy.
Unhappy.
All kind of negative emotions like very sad, depressed, anger. Yeah.
Yeah, true, correct. I think you got it right now. What is the purpose of showing you this painting? Or rather, let us understand what the artist was trying to illustrate with this painting. Catherine Brennan, the artist, okay, she drew this three faces of one person, The middle one is the one that the world sees. The one in the middle is what we normally see. We go to the market, walk along the street, in the public, we see faces like this. It looks quite normal, okay? Except that maybe not smiling. But if you look at this face here, and behind this face that we see and the world sees, it's actually behind this mask. This is a mask behind this face. I think it's actually a person with mental health issue, okay, mental illness. And so behind this face is this. This person is actually, is tormented. It's very fearful. Because why? She hears a lot of, very unpleasant, distressing voices. And it is actually, she is very, very tormented. And on the other side also, you've got this face, behind this face is actually, she's very sad. She is very, in despair. She is feeling very kind of upset. Now, this painting actually illustrates the fact of people with mental illness who may appear normal, but deep inside, there's a lot of suffering. There's a lot of suffering that we don't see. Only the person who has the problem will understand. And it is also something that is not openly shared because due to the stigma. I will show you later on that, there are the people, how much, disability or a functioning impairment that people with mental health problems suffers. But later I will show you that. Now we move on. Okay, now this is the one that I was going to share with you. Functional impairment in mental disorders. And this study was based on, in 2009, a US study involving thousands of respondents from their database of people with various mental illnesses and also various chronic physical illnesses. And the question posted to them was, now in the last 12 months, when the worst month or when your illness was at its worst, how would you rate your functioning, whether it's at home, at work, social functioning, or in close relationships? How would you rate it from 0 to 10? Okay, 0 means absolutely no impairment at all. 10 is a maximum. Okay, for physical illness, I think, it's quite easy to relate. And for mental illness, it's a person. The one who has it, will know. You may not know. So I'm going to show you how it is like for these people. Now you look at these green bars and the orange bars. Now the green bars are actually represent people with various mental illnesses. Okay, and you can see that bipolar disorder is 7.6. No, that is the worst. Actually, the worst is psychotic illness. But psychotic illness, because it's quite difficult to ask them, get them to answer questions. So it's not included. So, you see bipolar, depression, all of them were much worse than chronic backache, chronic neck ache. It can be very distressing also if you have got these 2 aches. You cannot sit for long, you cannot lie down properly, and also compared to high blood pressure. So where is that suffering and where is that disability? Now here it says it's at home, at work, for social functioning. And what do you call that? At home you think that what is there to function at home, Home is like, you're just at home, but actually at home, there's a lot of, you need to be very well to be able to, keep your house, to do the cooking, take care of the children, and even take care of the pets and so on and so forth. So there's a lot of work at home. Now, social functioning, you think that, well, so it's not important, but then it means that, going out, mixing with people, attending functions and all this, you can't enjoy that. And close relationships is also very important. Relationship with spouse, having close friends, and so on and so forth. So you can see that, this rating here is based on their worst rating in all the 4 domains. The worst one is taken as the global, and this is the global score. So now you can see that for the mental health illnesses, they suffer much more. Not so much on the physical disability or the physical impairment, but very much on the social functioning, the close relationship. And this is where the quality of life is affected in people with mental health problems. And it's the suffering that is inside them, which sometimes, because it cannot be shared openly, the suffering is even more severe. Now, so is mental health relevant to us then, even if after I share with you all on this? So what does it mean to us all? We still think that, well, it's not relevant. We are okay. We are moving on. Now, the Ministry of Health did a study. That was in 2015. And this is taken from, in the news on and off, you will have people, what do you call that, people, you publish in the news on and off. And this is what I call a news where the Deputy Director General of Public Health, said that 1 in 3 Malaysian adults are struggling with mental health issues. In fact, this study in 2015 showed that 1 in 3, 29.2% to be exact, of adult Malaysians aged 16 and above have some form of mental health problems, and not mental illness, because on and off is also being misreported as having mental illness. This is having mental health issues. And here he says that most mental illnesses don't improve on their own if left untreated, and may even get worse and cause many other serious problems, even like relationship problems. It can result in marital breakdown, family discord, and so on and so forth. Okay. Now, how was this derived? Actually, this was based on the 12-item general health questionnaire, where they asked respondents a number of questions on their ability, to cope, and also their daily living, whether they are feeling reasonably happy, able to cope with, normal day-to-day challenges, or they can't cope, they are worried all the time, they cannot sleep, constantly under strain, and feeling very unhappy and depressed. So this, based on these 12 questions, then there's a cut-off point, and 1 in 3 were found to have mental health problems. Now, to illustrate this further, okay, mental health problems and mental illness. So what is the difference? We look at this. The mental health is a continuum. We can be mentally, we are well, okay. We can be also mentally ill. It is also like a physical illness, and in between, we can feel stressed, anxious, we cannot sleep, we feel depressed sometimes, but we are not mentally ill, okay? We are not mentally ill. So these are mental health problems. So people with mental health problems are not necessarily mentally ill, but people who are mentally ill would have a lot of mental health problems. Maybe to explain further, when then does a person become mentally ill? Now we look at this. Mental illness is a condition that causes changes to thinking, emotions, and behavior. So there are 3 areas. It causes major disturbance to our thinking, emotions, and the behavior. And the behavior is sometimes secondary to the disturbance in thinking and emotions. And it's not just this. If you on and off you feel disturbed, you feel sad, that is not mental illness. If one day you are being caught talking to yourself, wow, don't think that you are mentally ill, okay? So to qualify for a mental illness, it has got to be prolonged, and persistent over time. So if a person who has got these changes and it seems to be so long, like depression must be at least 2 weeks, anxiety disorder maybe over a month, okay? And it's not just that, it impairs functioning, okay? Because of all these changes in, the various illnesses will give you different degrees of impairment, functioning impairment. And also it depends on the, the seriousness of the illness. If you are mild, okay, you can still function, but maybe the quality of your performance might be affected, okay? So this is what mental illness is. It is a disturbance in the thinking, emotions, and behavior. It's prolonged or persistent, and it impairs functioning. Now, next, what are the common mental health problems then? You see, if you go to the DSM-5, that is the diagnostic manual of the American Psychiatric Association, that is being used by all psychiatrists in making their psychiatric diagnosis. There are more than 200 illnesses that are being listed. But of course, some of them are not so common. And the common ones, maybe more than 80% would be, some of the problems areas that I share, I'm going to share with you here. The first one is psychotic conditions, like for example, schizophrenia, drug-induced psychotic disorders. And this one affects logical thinking. So just now we say mental illness affects thinking. And because it, affects logical thinking and their perception is also disturbed, they are going to have a lot of delusions, hallucinations, okay? And then there will be disordered behaviors, okay? Psychotic conditions, they are not the commonest, but because they're the most disturbing and most obvious, so it's mentioned here. Now, mood disorders. This is a second group of disorders that are common. In fact, the mood disorders are much more common than the psychotic disorders. They affect the mood primarily, okay? The logical thinking is intact unless they become so severe, then they become psychotic. And when they become psychotic, then of course the logical thinking is also being disturbed, and they can be just like a person with schizophrenia. Now, the mood disturbance, of course, if it is depression is clinically or medically is called major depressive disorder, or sometimes it is called clinical depression. So the mood is depressed, but depression is not just feeling depressed, it's just one of the 9 symptoms. So there's a criteria before you can say that a person has got a depression illness. Or a heightened mood during bipolar disorder. So again, during mania, and there are many other, besides the mood, there are many other signs and symptoms. And the signs could be from the behaviors, the disturbed behaviors. So there will be behavior changes. Then you've got the anxiety disorders, another big group. General anxiety disorder, now characterized by excessive worries and anxiety when there is no need to worry or to be anxious about. There is no stress, there is absolutely nothing, but they just feel so worried, that something bad will happen. They cannot sleep, they cannot, keep calm, okay? And panic disorder, these are sudden, attacks of anxiety, anxiety attacks, They feel panicky, palpitation, cold sweat, tremors, and it can be quite frightening to people. If you see one, you may panic yourself. Okay. Now, phobias. We generally have some phobias here and there, but it's not a disorder. As I say, it's only a disorder when it is prolonged and it is persistent and it causes you not to be dysfunctional. For example, a person who used to work in heights and all this, you need to climb ladders and so on and so forth, and then you suddenly develop this phobic disorder for heights, then you can't function anymore. You can't work in this kind of capacity. Or social phobia. Let's say a teacher. Okay, I know of a teacher who had this social phobia. So scared of being judged that he just cannot get off to work, He's in his 40s, but the parents have to drag him out of bed every day, to get him to go to school. But after he has gone to school, he's okay, he can teach. But just to go to the school, he has got this phobia, And after he's been changed to afternoon session, he still cannot, get ready, to go to work. So this is how distressing and how, impaired their functioning can be. Now, obsessive compulsive disorders, it is actually characterized by a lot of anxiety symptoms. They have got obsessive thoughts, thoughts that disturb them, that keep them very distressed, and they just cannot move on to other things because these thoughts of, like for example, they think that their hands are dirty, and they have got to find relief only, by the compulsion of wanting to wash their hands. So, they keep washing, and how sometimes you see that the detergent in the toilet disappear, Very one bottle within 1 week or a few days, every get this it goes off. Some are very disturbed by, orderliness. Everything must be in perfect order, arranged by height, by size, by color. But it is, some of us are obsessive. Doesn't mean that we have got obsessive compulsive disorders. A lot of people who excel in sports, in studies, in whatever they do, they are obsessive to a certain extent, and that's why they are being driven to perfection, in whatever they do. But this kind of obsession don't lead to distress. No? In other words, they must do, but then it doesn't mean that if they don't do, they can't sleep, or they get jittery, they get distressed, and so on and so forth. It's still under control, okay? It's just that they have got these obsessive traits, okay? And substance abuse disorders, drug addiction, alcoholism, these are also considered as mental health problems. So these are some of the common mental health problems that would cover more than 80% of what we see, or what the psychiatrists see. Now, a little bit on drug-induced psychotic disorder. Last time we used to have, our drug problem were mainly heroin, morphine, okay. But nowadays it's not those kind of items. So in fact, if you look at the statistics of the National Narcotic, the department, the trend has changed. It is now this amphetamine type, the stimulant drugs. Stimulant drugs are like ecstasy, shabu, ice, and whatnot. All these stimulant drugs, and these stimulant drugs, it can cause brain damage, and they end up with psychosis. And in fact, in the psychiatric ward, in many hospitals, you see that this is second commonest cause of admission, to hospitals. They are young people, and they are not necessarily the unemployed people. Some of them are executives, people who kind of, because they are driven, they have to perform, they take this drug, not realizing that it can cause damage, and they end up having mental health, mental illness. Okay, now we are now entering into mental health first aid. Okay, I've explained to you just now what is mental health problem and what is mental illness. Okay, and what's the difference? And I've also explained to you some of the common mental health, mental illnesses that we see. So what is mental health first aid? Now, first of all, I think we all understand first aid in general. Let's say, if we see somebody collapses, or, somebody falls down and then injures himself or herself, we know what to do, immediately we will approach a person, we will render first aid, okay? If you are properly trained, then you will know how to stop bleeding. If you suspect fracture, then you may know how to, splint the affected part. But generally, in first aid, we don't do the treatment, and neither do we do the diagnosis. Is that right? We have to go there, render immediate help, and then we will help them to see the right people, whether in the hospital or clinic, to get the right treatment. So that is the general this first aid that we are familiar with. Now, what about if, let's say, in your place of work or among your friends when you go out, and then you find that one of them appear to be mentally distressed. Now, do you know what to do or not? You think you know what to do and how to help the person? If the person were to say, I feel so hopeless, I feel like not waking up tomorrow, or I feel like ending my life. Now, would you know what to do? Or would you know how to help? Now, this is where first aid, mental health first aid comes in. And it is not so straightforward, and you need some training. Okay, now what I'm going to share with you this morning is just introductory, because you can't do a mental health first aid in 1 hour. Okay, we have training, and it's 2 days. So now, what exactly then is mental health first aid? Okay, by definition, it is the initial help offered to a person who is developing a mental health problem. Okay, developing, okay? and or who is experiencing a worsening of the existing mental health problem. In other words, this person has already got a mental health problem, maybe under medication and then stop medication, or maybe there's a relapse or worsening, okay, or experiencing a mental health crisis, like for example, a person with a psychotic illness, because of medication, usually non-compliance of medication, they become very distressed, very disturbed, and very aggressive. Or you have a person who is very acutely suicidal. Okay, so this is a kind of crisis, mental health crisis. So mental health first aid is the initial help offered to that person, and the help is given until appropriate treatment and support are received, or until the crisis resolves. So in other words, you are like a first responder, and you are there to provide the initial help and to support them and to make sure that they receive or they are being channeled to the right care needed. Okay, maybe this is not so clear. It will be clearer as we move on. And now, how did this came about? As I told you earlier, mental health first aid is something new. It's something new, and it is developed by this couple, Betty Kirchner, who is a nurse educator, and her husband Tony John, Professor Tony John, who was a mental health researcher in Australia in 2001. Okay, Betty actually has a few episodes of depression. And Professor John attended, I was at a national workshop one day, that discussed on mental health problems. And during the conversation, one person in the group said that, perhaps we should have something, first aid, for people with depression. Since depression is so common, why not we have a first aid for them? And then, that idea became crystallizes into a big thing that is to come. And during one of the walk in the park, with Betty, they discussed this idea of having a mental health first aid, and they extended it to not just for depression but for all the common mental health problems. And they took a few years, did research, interview people, living with mental disorders, interview caregivers, the professionals, psychiatrists, mental health professionals, and so on and so forth. And then they developed this program, what you call mental health first aid. And they are actually very smart. They registered this and patent this program, not just patent this program, but patent the name itself, mental health first aid. And therefore, mental health first aid is just a brand. It's just like Nike, Starbucks, McDonald's, Kentucky Fried Chicken. So you cannot use the word mental health first aid because it is a copyright word and the program itself. Now, since 2007, okay, it has now spread to now it's about 25, 26 countries. First, it went to Canada in 2007, then the USA, UK or Scotland first, then to some countries in Europe, Scandinavian countries, South America, Middle East, and in Asia. I don't know whether you can see, the last line there, I can't see here. In Asia, there are only 4 countries with this program. First, it was Japan. Okay, 2007, 2008, followed by Hong Kong, okay? And then India was 2017, and Malaysia, we came in 2019. Okay, now, so if you look at this, it's all over the world now. Every country will have their own logo, MHHA basically, this one, this is England, people say that this is like McDonald's. Okay, so you get all sorts of what call that, Okay, now, so we have what call that is mental health first aid Malaysia. What is it? Okay, what is it? It's a Malaysian program. Okay, it's licensed from MHHA International Australia, and to get this, we have to get a license. So not everybody can conduct this training, and And the Malaysian Mental Health Association, we are the license holder for the mental health first aid program for the country. And this program is not wholesale from Australia. It has got to be readapted and taking into consideration our healthcare system, our mental health problems in the country, our cultural, social, cultural, and even religious, scenario here. So we have to adapt it. And what we have now, oh dear, okay. Now we have this standard program, and this standard program was obtained in early 2019, and after 6 months of adapting, and so it was launched in 2019 in conjunction with World Mental Health Day. And then towards the end of last year, we also acquired the adolescent program because we realized that it is very useful, especially for children in the school or even in universities. People with mental health problems, they have got to be dealt with differently because adults can make decisions. Children cannot make decisions, and sometimes you have to involve the parents and the guardians. But on the other hand, some of the mental health problems in children could be also contributed, by problems at home or, let's say, child abuse. So there are certain peculiarities which a standard program cannot address. So we have got to, get another license for the adolescent program. So we have got 2 licenses now, and actually we wanted to launch it this year, in conjunction with World Mental Health Day, but because of the COVID, everything was shelved. And this is our mascot. This is a Malaysian Mental Health First Aid mascot. The mascot for mental health first aid is the koala bear. Okay, so this is our Malaysian attire for koala bear. Okay, now, so why do we need mental health first aid now? I think earlier one of the participants did mention that this is very essential. Mental health first aid, we have to know. Because why? Not everybody, can see psychiatrists. They are very, very limited mental health professionals in the country. 1 in 100,000 population. The ideal would be 1 in 10,000. Okay. And then for clinical psychologists, it is even half of that. So they are very, very limited mental health professionals. So we cannot depend on the psychiatrists alone to be providing mental health care. And the other thing is not everybody with mental health problems need to see a psychiatrist, no? Okay, so there are also other forms of help. And what are they? So we can do a lot to help people with mental health problems without having to go to see a psychiatrist. The next important thing is, of course, mental health problems affect, first of all, a person's potential and future. And like, for example, an adolescent, a student, they are still schooling. They have not graduated. They have not started working. They have got a whole future in front of them, and if their mental illness is not being detected early and addressed, the whole future will be affected, will be ruined. Now, it also affects performance. A person may lose a job because of mental health problem that is not being attended to. At home, it wreck the home. It will destroy marriage with mental health problems. Relationships, you lose your friends. You have got no friends, you suffer. You live a lonely life. And it can be fatal. Not fatal because they say that 15% of people with depression and untreated will eventually, take their own life. So it can be fatal. And therefore, it is very important that early intervention can lessen damage, save jobs, relationships, and most of all, save life. That's why we need to equip ordinary people to be able to recognize mental health problems and offer some initial help. okay, and at least not to direct them to the right people for help. But how do we do that? Okay, so now, so essentially in mental health first aid, what we are talking about is being able to recognize a mental health problem or crisis. So what is a mental health problem? How do we recognize it, you know? Okay, and how do we approach and give assistance? How? It's not so straightforward. Now I give you an example of how, you know, I'm a doctor and I was talking to another doctor, and a very simple thing like that, I thought I was talking to a doctor, no? And how sensitive it can be. Now, that was about 20 years ago. I, was organizing a class reunion, and there was this classmate who didn't want to attend, and I was kind of talking to her, encouraging her to attend. But I heard that she had some problems. She had actually stopped practicing, dysfunction, okay? Dysfunction. And she couldn't drive, although she has got a license and has been driving. So I kind of blurted out, I said, "Oh, are you depressed?" Wow, my goodness. Just that question, I have another, many minutes of lecture from her, She scolded me. "Oh, how can you label me as having depression? You just listen to me only, for a few minutes and you say I have depression?" Actually, it's all for good intention. I was just asking her, "Have you got depression?" I was going to continue with the next sentence to say that actually I had depression before. No, I know what it is like. I was kind of thinking that I can help her. I understand what it's like, but I had no chance to say that. By the way, depression is so common, and I'm not ashamed to say that I've had depression before. That's why I'm involved with mental health, Malaysian Mental Health Association. It's very common, often unrecognized, and many times it is being denied, and somehow it can go off by itself if it is mild. So it's very common. So anyway, so you see, how do you approach and how do you ask a question? It's very important. You cannot simply go and ask, "Hey, are you depressed? Are you having this illness or that illness?" You cannot do that. There is a way to approach it, and this is where you get the training from mental health first aid. And then you have to encourage seeking appropriate mental health professional help, appropriate the mental health professional. But who to see? Is it a psychiatrist? Is it a GP? So when to see? Does a person really need to see a psychiatrist? Or maybe not needed. So when is it needed? So this question also will arise. And where to find them? Okay. So this we take for granted, that is very straightforward, but it's not that straightforward. Okay. So providing information, support, and help. Now, what are you going to say? What are you going to share? How are you going to help? And where are you going to find all this kind of help? Okay. So without knowing and understanding, you may not be able to help effectively. You don't need to diagnose. You don't need to treat. But to support and help, you need to know something, okay? And you need to be trained. So what is mental health first aid? What is our aim then? It is to provide you with the knowledge to help a person with mental health problem or in a mental health crisis and refer them to appropriate professional help or to give them appropriate support. Now, it is not aimed at enabling mental health first aider to diagnose or to treat a mental illness, just like a physical first aider. No, you're not expected to diagnose or to treat. So it is to build a mental health literacy, okay, to identify, to understand, and to respond to signs of mental disorder so that early intervention can be instituted before more damage is done. Now there's another term here. psychological first aid. Now, psychological first aid sometimes is being confused with mental health first aid. There are two different things. You can't use psychological first aid for people with, to help people with mental health problem. This is actually more preventive. It is in the setting of a disaster, in war, in, for example, in the tsunami, in earthquake, floods. Okay, this is to protect the mental well-being. And it was developed, in the US after the 9/11 incident, okay, where for the first time, the people in New York and even throughout the country, they were shocked, they were traumatized. And and this trauma, it can actually result in post-traumatic stress disorder, another mental disorder. And to help them to overcome this trauma, so we have got this psychological first aid. But this is not patented. And because it's not patented, you have got many versions. It depends on which group, who you are helping, and how you approach. Okay? So it's free for all. Malaysia has got our own version, and in Malaysia itself, there are many groups. Different groups will have different approach. Like Mercy Malaysia will have its own approach, and so there are different versions of it. But mental health first aid, no, it is one standard way, one approach. Okay, although it's not rigid, okay, but there is a system in it, how it is being carried out. So here now, what is the role of mental health first aid? So if you look at this chart here, figure from wellness to being unwell and recovery. So mental health first aid is not here, not in the treatment part, but it is more, and it is also not in prevention part, okay, but it is more during when a person is becoming unwell, or even when they are unwell and then they show signs of relapse, or they are in crisis, then we must be able to recognize them and then institute early intervention. So this is where mental health first aid comes in. Now, so just now I was telling you where to seek help. So I just share with you some information because this you will be able to at least know something and take back some knowledge. I think all of us, we know what is psychiatrists. Psychiatrists are medical doctors. And because they are medical doctors, they can prescribe medication. No other mental health professional can prescribe medicine except for the doctors. So basically, psychiatrists, they diagnose and they treat mental disorders. Then we have got the next group, the so-called psychologists and psychotherapists. There are many types in this group. Now, the one that specializes in mental health is actually the clinical psychologists. Now, they are trained in providing assessments and also to provide therapy for people with mental health problems. But the therapy is not medication because they cannot prescribe. But they have got ways of, helping people with mental health problems to cope, to learn how to, configure their perception of things, to adapt, to have better ways of coping, okay? And they have got 2 years of postgraduate training. And during this training, they have got the clinical practice, okay? And they are covered by the law. Whereas the psychologists, general psychologists, let's say a person with psychology, graduate, they are not psychotherapists, okay? A psychotherapist, it can be anybody with any background. They go for training in specific areas of therapy. It can be behavioral therapy, hypnotherapy, play therapy, and so on and so forth. There are many types of therapies depending on what area. So they are trained to provide certain targeted areas of therapy. Then you have got the counselors. Now, a counselor, a basic degree counselor, they are not trained in managing mental health problems, okay? And but some of them have working experience. Okay, so you've got a school counselors. School counselors are not trained in mental health. Okay, they are trained in behavioral problems, in children with social problems that requires interpersonal therapy and family therapy. Okay, so but invariably people with mental health problems also with they also have interpersonal relationships, communications problems. So counselors do provide they can provide help for people with mental health problems. So, but basic degree, they are not trained. And now the master's program, they have got also some universities offer a mental health component. Now, what about GPs? Okay, most of us, if we are sick, we go and see a GP. So for GPs, we can't say that all of them are trained. It depends on their training. Those that graduate from our local universities, our Malaysian program, we have got, most of our programs have got psychiatry in it. But, Malaysia, we have got 36 medical schools, including private ones, and we recognize another 350 over medical schools throughout the world. So depending on where they are trained, and what is their training, curriculum. But I would say that in future they'll be trained because why? Now housemanship training, there's the option, even if they are not trained, there's option for them to be to undergo psychiatric posting. Okay, and some of them, even though they are not trained, they attend courses based on their interests. And from their experience also, they will gain experience. So I know that there is one pediatrician in Alostar, and I was talking to somebody, in Penang. And she took the brother all the way to Alostar to see this pediatrician for psychiatric problem, So this is what they call the interest, okay. And this lady seems to be quite good, with mental health problems. And by word of mouth, she became like a psychiatrist, okay. So now, where do we find, I'm coming towards the end, okay, where can we find mental health services? For psychiatric service, okay, in the hospitals, to see a psychiatrist, you need a referral. You cannot just walk in, and say that you want to see a psychiatrist. You must bring a letter, either from the GP, from the clinical kesihatan, other hospital, or through the emergency department. Or we can also, the Mental Health Association, we can also give you this referral. And then, what about walk-in? Can you just walk in to a psychiatric clinic without appointment? This is only for their own patients, people who are already, registered with them, and then they develop some problem. They cannot wait until the next follow-up. But if they go there, sometimes they are not seen by a specialist. They are seen by a trainee. And then the private sector, of course, private sector, you've got the psychiatrists in the hospital, in the clinics. You just call up, make an appointment, and you walk in because you pay for it. Then you've got NGOs, MHHA, Befrienders. MHHA is, quite a new one. This is the Mental Illness Advocacy and Support Association, okay? So now, MHHA, we have been in existence since 1967, more than 50 years. But for a long time, we were dealing with providing psychosocial rehabilitation for people recovering from mental illness. We were at the Old Town PJ, but now that center has been redeveloped. Now we are building a new residential home there, and we have moved to this the Mind Hub at Plaza TTDI. It's just very near here at the Hero Supermarket or the TTDI MRT station. Okay, so it's up on the second floor, and okay, we provide psychotherapy, counseling, psychological assessment, psychiatric consultation. Limited here is, we have volunteer from the university, so it is by appointment only. Now we conduct a mental health first aid training. We give public education and caregiver education. Caregiver education is a 3.5 days spread over 4 weeks on the weekend. 12 modules, okay? for people who have got a loved one in mental illness. So we have got, you know, the PJO town, this for a timing is not functioning. Okay, now we next go to emergencies. Okay, now what do you do when you encounter a mental health emergency? So like in acute psychosis, very disturbed, aggressive, or threatening. Yeah, okay. So acutely suicidal, attempted suicide. Okay, so what do we do? We bring the emergency department or we call the police. Now we don't call the ambulance to come to attend to a person who is very aggressive because they cannot cope. They cannot manage this type of people. You have to call the police. By law, the police are empowered to provide assistance for psychiatric emergencies. If a person is of harm to himself or herself or to the others, you call 999. So don't call the ambulance unless they have also got a medical problem, like for example, a person who's overdose, or the kind of severe bleeding due to injuring themselves. Okay, now this is I think the last one. Okay, so now how do you get training? Okay, we have got this training. Okay, it's 12-hour course, 2 days, 3 hourly modules stretched over several days, and interactive sessions with case study, role play, and it covers our view of mental health problems, first aid in all the common conditions, and seeking help. Okay, so this what I show you here is this is the actual training. So the what I share with you today is just an introductory. Okay, so I think that's all that I have to share. And if you have any question, now I hand it back to our what do you call that, moderator. Thank you.
All right, thank you, Dr. Ang. That was very, very insightful. We've now reached the Q&A session. I'm going to start off with okay, so basically, everyone reacts differently to stressful situations, right? And mental illness is not the same as physical illness, in a sense that when you're suffering from a physical illness, there is people can see the symptoms. So you might be coughing, you might be sneezing, but that's not the case for mental illness. So my question is, how do you know that someone is suffering from a mental health condition, since it's not so visible? What are the common symptoms?
Okay, yeah, it's a good question. Now, you see, for mental health first aid, unlike physical first aid, you can give to anyone. Physical first aid, you what do you call that? You go any stranger, okay, you can provide first aid. But for mental health first aid, is usually provided to people people who are close to you, like in the family, among your friends, in the workplace. So, because they are known to you and you're close to them, you notice that there are changes, There are changes in them. And this is very important, the change. And the change is quite substantial and is quite prolonged, persistent, the definition of mental illness. Okay. So you see that, you have changes in their thinking, they may express, like say, very negative, or they become very delusional. They tell you things that you think it is not, like they say, oh, somebody is trying to harm them, or the colleague is talking bad about them, and so on and so forth. Or the mood, they change their mood. Last time they used to be very talkative, now they are so withdrawn, okay? And the behavior, okay? They keep having, let's say, to leave, to go to the toilet, or to wash their hand, or they don't want to take part in certain, activities now. Okay, so there are changes. But the other thing is, sometimes because they express you, they share with you, so you know. Okay, and And sometimes you have to ask them lah. You have to ask them, because you see the changes, and because there are some behavior changes, or even like they become so moody, so irritable. You may just talk to them and find out, is there anything that is troubling them, or if you could see that their performance is deteriorating. They used to be very good student, for example. How come now is deteriorating? So there may be something troubling them. So this is how you find out.
All right, thank you. We have a very popular question among our viewers here. So with regards to the mental health first aider, how can a person be trained as a mental health first aider, and is there any fee that you need to pay?
Okay. Now, unfortunately, because this is a licensed program, so it's and it has to be provided by the certified instructors. Okay, and so there is a fee involved. Now, for the individual, okay, generally we charge 800 for a 2-day course. But there are also rates for people who are involved in NGO work, or for students, we charge half of that. There are also rates for the corporate sector, where it is in the group. So, but the maximum we can take is only 20 to 25, and that is not because there's a lot of interactive group work, presentation, so we cannot afford to have many, because there's no time. So, and we have got a community group. Now, I think, you see, our, what I call that, SS20, we have a group of mental health first aider. In fact, they were the first group to be trained. And it is complementary because actually how this mental health first aid license came about, it is being sponsored by SS20 Cares Charity, okay? And because of that, now we organize one specially for them. But we are trying to work out something for community groups that, if there are communities who are interested, because we need to train more people, okay? So you contact us, and then we'll see how we can organize one for you.
Yeah. All right. I hope that answers everyone's question about the mental health first aid course. Now we have a question from Esther. She's asking, what is bipolar disorder?
Oh, bipolar disorder. Well, you Google and find out, because why, this it will take a long time for me to explain. You see, bipolar disorder, basically there are two parts of it. One is depression, the other one is mania. But in between, there is what we call hypomania. It's not so mania. When they are in the depression mood, they are just exactly like anybody with major depressive disorder. When they are mania, they will be very high, very active. And one of the classical thing is that they are so active, so much energy. You don't have to sleep. For us, we don't sleep for 2 to 3 days. You can see, you are totally exhausted. But for these kind of people, they are still very active, very energetic, moving around, doing a lot of things. But sometimes when they become so manic, they become irrational, and they can be a danger to themselves. They can overspend, You have people throwing money in the, in the mall. I suspect that person must be having mania. They feel that they're so rich, they want to share, their money with everybody. Okay. I think a lot more. I think it's better to go and read up. But basically, for bipolar disorder, they need to be treated. They need to be treated because it can go out of control. Okay, it can go out of control, and it can be helped. So you don't have to work on that. Seek help. Okay, and sometimes bipolar disorder, it starts with a depression. Okay, next one.
All right, thank you, Doctor. We have another question from Guat B. Forgive me if I pronounce your name wrongly. So she asked, do psychotic conditions and mood disorders need to be diagnosed medically? And what if the person refused to go and see the doctor?
Well, if a psychotic condition, I think they need to see a doctor. Although, they can be helped by other forms of support and therapy, but they will need medication. And the most difficult thing for them is refusal to see the psychiatrist or a mental health professional and refusing to take medication. It's very, very common. It's always a dilemma. So, and because they are rights, they have their rights, no? So, so sometimes you may have to, by coercion, okay, by emphasizing that, let's say, if they have become so dysfunctional and unable to, say, retain a job, you may have to say that, well, if you want to be able to work and you may need to go and see somebody to help you. But I think the most important thing is for them to, first of all, to accept the fact that they are not well, that they need help, acceptance. But acceptance for depression may be easier, but for psychotic conditions, because of their disturbance in thinking, sometimes they are no longer in contact with reality. So they will deny that they are sick. Then the other one is to give them that there's a hope, that it can be better than what they are now, that they can be helped, and persuade them. And another thing is perhaps to get them to move on. Sometimes you may have to accompany them to give them the extra energy and extra thing to take the next step. Okay, because some of them will keep delaying and think that, well, no, it's okay, wait, I'm getting better and all this. So, but it takes time. But unfortunately, sometimes it is until we know of people that at the end they become out of control. Like there was one, then they went around destroying public property, and then the police have to be called, and then they have got to be brought to the hospital by involuntary incarceration. Okay.
One more question. Child abuse is becoming very common in our society. How do you classify the child abusers, under which psychiatric term, and how do we counsel the victims and the abusers? This is the, sorry if it's a difficult question.
This is outside the scope of mental health first aid. But and what I can say is that a child abuse often is associated with mental health problems, or rather mental health problems underlying problem is child abuse. And this is where in the training for the adolescent program, we teach the people that, first of all, you have to find out, you have to talk, you have to, and if there is an element of child abuse, you have to seek help, because they are protected by the law, and you have to get them. And sometimes you cannot get the family come in because it may be caused by the family member, even the parent. So you have to get help from the social welfare NGOs that are involved, and that becomes a child abuse problem. It's not a mental health first aid, but the mental health first aid is to be able to recognize people who seem to have mental distress, and then to direct them to the right people for help. So your role ends up there, so I won't say further, because your role ends up when you have directed them to the right people.
All right, so I think we still have about 3 or 4 more questions.
Yeah.
The next question is from Agathe Maybell, and I think I personally find this question interesting. What do you think about people who self-diagnose themselves with mental illness? What are the more appropriate ways for them to explain that they show symptoms of psychopathology without associating it with the disorder?
Yeah, it's interesting. Okay, now because of nowadays we have got the online. There are a lot of resources now. Okay, but actually the end point is it doesn't matter. What is your diagnosis? Okay, what is important is so what. So what? Because why? You need to be helped. Okay, you need to be helped, and so having found out that you may have a problem. Okay, now if it is mild, there are also a lot of self-help remedies. Okay, self-help remedies. And gaining insights on the problem that they have is the first thing towards recovery. Okay, understanding like they say panic attack. Now you understand it's a panic attack, and you know that how then you can manage your symptoms and you're less fearful. If you're less fearful, then you have got less, maybe less attack and so on and so forth. But then. If let's say it is dysfunctional, then they have got to seek proper help, so they must have a follow up. So it's nothing wrong with self-diagnosis, because they are not self-treating. They are self-treating in a certain way. Is some kind of remedy, but of course when it is mild, is okay, because certainly even healthy lifestyle, having proper sleep, exercise, having hobbies, talking to people. These are some of the remedies, some form of therapy for people with mental illness. Yeah.
All right, thank you, Doctor. So coming back to the mental health first aid course, someone asked if there is any prerequisite qualification or if there is any age limit.
No, people who attend this, to be a first aider is no prerequisite. It's just that you just apply and then you pay the fee, okay, and that's it. Now, unfortunately, because of the COVID, we have, we used to have this face-to-face interactive session, and that is more effective. So because of COVID, we have got to do it, virtual, and so we have started already virtual. In fact, with the Philippines and with Indonesia. So, but it's I find it's still not so smooth yet, okay. Yeah. So no prerequisite. Anybody can be a first aider. The only prerequisite comes in if you want to be an instructor.
What about any age limit?
No age limit. I mean, if you are interested, okay. So, but I suppose adults, let's say a standard course is for adults. But if they are underage, your age 16, you are under, the maturity age. Well, I suppose it is no harm, because this is just literacy. It's mental health literacy.
All right, thank you, Doctor. The next question is from Jok Teng. He's asking if the Mind Hub is providing free or paid services.
Okay, yeah. The Mind Hub, in fact, what we provide, there's a fee, but our fee is below the market rate. It may be 50 to 60% of the market rate. But for those who cannot afford, we they can apply for subsidy. And this is where, you see, the reason why we charge fee is that we don't have our own psychotherapists. They come from the private sector, from individuals, and they practice in MHHA. So we have to pay them a fee also, and therefore we have to charge. But then because we are an NGO, and because they work for an NGO, they are also willing to take a lesser fee. And for those who cannot afford, then they apply for subsidy. And that is where, all the income generated, like for example, in the mental health first aid training, it will be generated to support people who cannot afford to pay. So depending on how much they can pay, okay, then we will provide the subsidy. There are also trainees under supervision, and sometimes they can also provide good service. Yeah, so there are options for lower fee service.
All right, I hope that answers your question, Jok Teng. The next question is from Yvonne Petrina Patrick. She's asking, is seeing a clinical psychologist instead of the psychiatrist more appropriate when it comes to minimizing stigmatization of a particular mental health condition?
Yeah, okay, very, very interesting as well. Now, first of all, when do you see a psychiatrist? Now, in Malaysia, the psychiatrist came in first, then only a clinical psychologist. So invariably, when you talk about mental health problems, we say that you go and see a psychiatrist. Generally, you see a psychiatrist, okay, if you don't know what is a problem, you need the problem to be diagnosed. Is it a mental illness? Okay, so there is this question. Then the next thing is, you may need it to be treated, medicated, and you're also not sure, do I need medication? So the people, the expert in this, to make the diagnosis and to treat you or not to treat you are the psychiatrists. So you go and see a psychiatrist. And because the psychiatrist is easier to locate them because they're in the hospitals, they are in their clinics. So we tend to go and see them first. And then if the psychiatrist think that you benefit from psychotherapy, they will refer you to a psychotherapist. So it is actually the reverse. In some countries, they will see a psychotherapist first, and the psychotherapist think that they require, treatment, and they refer them to the psychiatrist. Now, going to, let's say, besides psychotherapist, let's say a counselor. Sometimes what may happen is that, they continue to give counseling when this person obviously, needs more than counseling. Although some people don't like medication, I must tell you, medication can work wonders. If you think in terms of, the mental illness in particular, like a depression is due to biochemical imbalance, and medication balances up your chemicals. And it's the fastest way. And if you are in a critical job or you're facing, you have to be very alert and very well, then, and you need it to be well fast, then medication may be, and while a psychotherapy can support and be a supplement.
All right, I think we have time for maybe 2 more questions. So the next one is from Harriet Wong, who's asked, is the counsellor involved in the role of the mental health first aid processing in order to help mental illness patients?
Can you repeat the question?
Does the counsellor, I guess he's asking, is the counsellor involved in the role of the mental health first aid processing in order to help mental illness patients?
Yeah, as I say, the counsellors they are in the basic degree. They are not trained to handle mental health problems. Even to kind of pick up, which one is depression, okay, which one is anxiety disorder, okay. So they are not trained, okay. So they may continue to just give you, therapy, talk to you, encourage you, and so on and so forth, when you would benefit from, let's say, medication, seeing a psychiatrist. So they are not trained, but postgraduate training, the master's program, some of them are now having, some universities offer this mental health option. And we are, in fact, training school counselors in mental health first aid. We have started in KL, 100 of them, and the Rotary Club, there's one national coalition for mental well-being, is looking into, a big program to train the school counselors. So there is a great scope for them to be trained in mental health first aid.
All right, thank you, Doctor. The last question is actually a follow-up question from Agathe Maybell. She asked, regarding the self-diagnosing from before, wouldn't it be disrespectful to those officially diagnosed with the illness when someone else who haven't gone to a professional to claim of having the same illness?
Does it matter to us or not? What actually matters is to the person, okay? Whether the person will have the, the benefit of proper treatment, because why? It doesn't mean that, they are more privileged, they can diagnose themselves, okay. So it's okay, as I say, depression, you may, go and do some screening and say that, you have, between having a mild depression and being depressed, sometimes it may be, what call that, you might even recover, after you're being removed from the stress that induces the depression. So I would think personally, it is okay unless it becomes serious and it is become a threat and it's become harmful to the person to persist in self-diagnosis and self-treatment. The worst is, a person with a real illness and they think that they are not ill, okay, or they are, and they think that they are having some other thing. So I don't know, I can just generally answer the question unless you have a very specific example.
All right. Thank you, Doctor. I think that's all the time we have for now. But in any case, if the audience still have any questions, I believe you can write to admin@mmha.org.my. Is that correct?
Wait, let me see. Oh dear. Let me see whether I can go back. Go back to the share.
But yeah.
Okay. On already.
Yes, we can see your screen.
You can see, but I can't share screen. I supposed to. Okay. Yeah. This is the contact. You can, if it is anything to do with this talk, okay, your question has not been properly answered, you can write to me directly. secgen@mmha.org. If you want to ask anything related to service, then you either telephone the My Hub or you write to admin@mmha.
All right. Thank you so much, Doctor. Thank you for the talk. It was very, very informative and it was very insightful. And yeah, thanks again everyone for joining our session today and staying till the very end. I hope you learned a thing or two, because I certainly did. We hope to see you again in our future programs.
Thank you very much, everyone, and enjoy your weekend. Thanks a lot, and thank you, Doctor, and thank you, our moderator, Nazila. Yeah, thank you very much, everyone. Thanks a lot. Thank you very much. Bye.